السلام عليكم ورحمة الله وبركاته. طلاب الصف الثاني عشر متقدم إن شاء الله بإذن الله. اليوم بنشرح هيكل امتحان مادة العلوم الصحية. قبل ما نبدأ الشرح أتمنى منكم الاشتراك بالقناة وتفعيل زر الجرس ومشاركة المحتوى مع الجميع لكي نستمر إن شاء الله في عرض المزيد والمزيد من المراجعات النهائية في مادة العلوم الصحية. إن شاء الله اليوم هنسرد الهيكل مع بعض، وإن شاء الله كمان أسبوع قبل الامتحان كده هنزل لكم أقوى مراجعة نهائية للأسئلة المتوقعة في مادة العلوم الصحية إن شاء الله. تمام. Grade 12 Advanced Coverage Document Exams. Best 20 answer out of 25 will count. Examples: 14 correct answer yield a grade of 70 but divide 100, while 20 and 23 correct answer yield a full grade of 100 divide 100 each. Okay. First question: what is the role of community pharmacist? Community pharmacist, which is a types of a pharmacist. The criteria المعايير لهذا السؤال: identify the evolving، إن أنت تتعرف على تطور. evolving meaning developing the role of the pharmacist in different disciplines. First, we have what is the role of community pharmacist. Community pharmacist who work in what? Work in a pharmacy where you would go to buy a medicine. يعني الشخص اللي بيعمل فين؟ في صيدلية. where you would go to buy a medicine، انت بتروح له عشان تاخد منه الدواء. Criteria for question 2: define pharmacology, pharmacokinetics and pharmacodynamics, and discriminate between drugs, medicines and excipient. First, we have pharmacokinetics, which is the study of what the body does to the drugs. Pharmacodynamics, it is the opposite. Okay. First, my question in pharmacokinetics: what is metabolism? What is metabolism? What is distribution? What is absorption? What is excretion? Okay. في السؤال بتاعنا what is a metabolism? Metabolism, what the body does to the medicine. This is the meaning of metabolism. Another meaning of metabolism is the process by which your body converts what you eat and drink into what? Into energy. Clear? Absorption, which is how the medicine gets into the body. Distribution, where the medicine goes in the body. Excretion, how the body gets rid of or remove the medicine. Clear? The next question is: which part of cell does drugs react with when enter the body? Which part of the cell? Your answer is receptors. When drugs enter the body, it starts interacting with receptors. بتفاعل مع مين؟ مع المستقبلات. Receptors are the part of the cell that connect to، بيتصل بإيه؟ substance and cause a chemical reaction into the cells. There are many types of receptors for different purposes. عندي أنواع مختلفة من المستقبلات ولها أغراض مختلفة. Cell receptors can be بتكون موجودة فين؟ can be on the outside or the inside of the cell. If they are on the outside، لو هي خارج they are known as what? Yes, cell surface receptors. If they are on the inside، لو هي موجودة inside, this is intracellular receptors. Okay, when drugs connect to a receptor, the level of the response differs. There are three different levels of responses: full agonist, partial agonist, and antagonist. والتلاتة ممكن يجي عليهم سؤال. السؤال هيجي في الفول agonist يقول لك a receptors produce a maximum effect. Maximum effect, this is a full agonist. Produce less than maximum effect, this is a partial agonist. This is no effect, this is antagonist. Clear؟ السؤال إجابته كلمة واحدة وهي كلمة receptors. Next question: what may happen if a person was to take high doses of NSAIDs for a long time, and what conditions can be treated with non-steroidal anti-inflammatory doses? Taking high doses of NSAIDs, this is abbreviation is non-steroidal anti-inflammation doses, for a long period of time can cause what? Ulcers, قرحة اللي هي قرحة المعدة, to develop in the stomach. This can be very painful. You should never take more than one type of NSAID at the same time. This is the answer for the part 1 of the question. What may happen if a person was to take a high doses of NSAIDs for a long time? Your answer is can cause ulcers to develop in the stomach. This can be very painful. You should never take more than one type of NSAID at the same times. The next, the part 2 of my question: what conditions, ما هي الحالات, can be treated with NSAIDs? It's used to treat a condition such as toothache اللي هو وجع الأسنان, swollen gums, migraines اللي هو الصداع النصفي, pains الألم, fever الحرارة, inflammation of the joint or arthritis اللي هو التهاب المفاصل, and swelling. Clear? The criteria of this question: identify how different doses form its routes of administration and those adjustment impact upon the clinical outcomes of drug administration. This question is clear? Yes. Next question: what is a generic name for a painkiller? The generic name for painkiller is paracetamol. Paracetamol is an example of a generic name for a painkiller. It has very few side effects and is available in many forms. Paracetamol relieves pain and reduces fever. It treats conditions such as headache, muscle aches, arthritis, backaches, colds, and fever. The criteria for this question: identify how different doses from routes of administration and those adjustments impact upon the clinical outcomes of drug administration. Your question is: what is a generic name for painkiller? Your answer is paracetamol. Clear? The next question is: which type of medication are usually administered topically? Yes. Topical, the drug is administered in the form of cream or gel applied directly to the area that needs treatment. This is used when the area needs to be treated. It is easy to reach, and it includes areas such as the skin, eyes, ears, and nose. In medication topically creams, lotions, gels, ointments اللي هو المرهم، spray الرشاش أو البخاخ، inhaler الاستنشاق، liquids اللي هي مين السوائل. This is a medication topically. Okay. The criteria for this question: identify how different dose forms, routes of administration, and dosage adjustment impact upon the clinical outcomes of drug administration. The next question is, what is the route of administration? The route of administration, this means by drugs are taken by mouth. عندي أدوية تاخدها عن طريق الفم such as tablets like Panadol. People who have asthma الأشخاص اللي عندهم ربو use an inhaler بيستخدموا جهاز الاستنشاق. Some people have used gels or creams as pain relief or to stop an infection لكي يوقف من العدوى أو الإصابة. In other situations, medication can also be given intravenously. This is injected into a vein or in a hospital or clinic. Okay. السؤال ممكن يجي في الجزئية دي بطريقة تانية، يقول لي what is the buccal route of administration? What is the buccal route of administration? What is the buccal route of administration? Your answer is between the jaw and cheek. Okay. Here, the criteria for my question: identify how different dose forms, routes of administration, and dosage adjustment impact upon the clinical outcomes of drug administration. Clear? السؤال بيقول what is the route of administration? Route of administration, this means by drugs that are taken by mouth such as tablets like Panadol. People who have asthma use an inhaler جهاز الاستنشاق. Some people have used gels or creams as pain relief to stop infection. In other situations, medication can also be given intravenously like injected into a vein in a hospital or clinic. Clear? The next question is, when should a patient be given antibiotics? When should a patient be given antibiotics? متى يجب إعطاء المريض المضادات الحيوية؟ Normally, when bacteria multiply or become more in the body, لما البكتيريا بتتضاعف أو بتصبح أكثر في الجسم, the immune system can kill them and fight the infection. الجهاز المناعي بيقتلها وبيحاربها هذه مين العدوى. However, ومع ذلك الإجابة هي sometimes the body immune system cannot fight all the bacterial cells by itself. الجهاز المناعي في بعض الأحيان مش هيقدر يحارب هذه البكتيريا بنفسه. This is when antibiotics are used. When antibiotics are used properly, they can cure infection and they can save lives. Okay? When should a patient be given antibiotics? When conditions are unlikely to clear up without the use of antibiotics. Okay? تاني, when should a patient be given antibiotics? Antibiotics are only needed for treating certain infections caused by bacteria. Normally, when bacteria multiply, لما البكتيريا بتتضاعف الجهاز المناعي بتاعنا بيتعرف عليها وبيقتلها. بس في بعض الأحيان الجهاز المناعي ما بيقدرش إن هو يدافع عن هذه البكتيريا بنفسه. فبالوقت ده يجب علينا إن إحنا نعطي للمريض give a patient what antibiotic. This is when antibiotics are used وفي الوقت ده نستخدم المضادات الحيوية. Okay. The criteria for my question: identify the appropriate use of antibiotics or the outcomes of antibiotics. Appropriate use of antibiotics. What can cause antibiotic resistance? The criteria for this question: identify the appropriate use of antibiotics. What can cause antibiotic resistance? Yes. Some medical professionals believe that people are, your answer is, overusing antibiotics. These overuse explain بتوضح the growing number of bacteria نمو عدد البكتيريا that are becoming what? Excellent resistance to antibiotic medication. In other words, the antibiotics become useless against the bacteria. Why? Because the bacteria have improved their defenses. تمام؟ Then, what can cause antibiotic resistance? Overusing antibiotics. This overuse بيوضح لي the growing number of bacteria that are becoming resistant to antibiotics medication. In other words, بطريقة أخرى, the antibiotics become useless against the bacteria. ليه؟ إيه السبب؟ Because the bacteria have improved. Because the bacteria have improved, okay, their defenses. A patient prescription read amoxicillin 1 TSP and PO and PID x10 days. What does this mean? This means take amoxicillin 1 teaspoon, TSP teaspoon, teaspoon by mouth. Okay. BO meaning what? By mouth. BID on prescription, seen on a prescription. BID means twice or 2 times. Okay. By mouth 2 times, 2 times in 10 days. Okay. Teaspoon by mouth 2 times in 10 days. Clear? The criteria for this question: interpret basic lesion prescription abbreviation اللي هي الاختصارات. TSP meaning teaspoon, PO meaning by mouth, PID meaning 2 times or twice in 10 days. Clear? The next question is, what is the IV route of drug administration? IV الاختصارات abbreviation IV meaning what? Excellent, meaning intravenous. Meaning what? Intravenous. This means they are sent directly into your vein using a needle or tube. In fact, the term intravenous means into the vein with IV administration. Okay, your answer, your question is, what is the IV route of drug administration? Your answer is what? Intravenous. Clear? Okay. The doctor prescribed 500 milligrams of drugs that is available in a stock strength of 100 milligram. Calculate how many tablets how many tablets are needed using the basic formula will be given in the exam. طبعا الصيغة أو المعادلة اللي هتستخدمها عشان تحل بها المسألة هيديها لك في الامتحان. عشان تحسب number of tablets needs اللي انت محتاجه هتعمل ايه؟ هتقسم ال prescribed dose divide stock strength. ال prescribed dose prescribe does equal what? The prescribe with 50 milligrams. Okay, and stock strength stock strength how stock strength 100. انت محتاج مين؟ number of tablets. okay, علامة استفهام. number of tablets equal prescribed does equal what? 500 milligram divide 100 milligram. يبقى إذن the number of tablets is equal what? 5. Clear? The criteria for this question is demonstrate the competence in broad range of basic scientific and pharmaceutical calculations. Okay. يبقى 5 tablets. The doctor prescribed a 500 milligram dose of solution. It's available in a strength of 250 milligram per 5 milli. How much solution is needed? Formula will be given in the exam. طبعا الصيغة هيدالك في الامتحان. تمام. عايز يحسب مين؟ amount of solution. Amount of solution equals what? Desired dose divide stock strength times stock volume. The doctor prescribed 500 milligrams. This is what? This is desired dose of solution, and strength, stock strength equal what? 250 milligrams. Stock volume what? 5. تاني it desired dose equal what? 500 milligrams, and stock strength equal what? 250 milligrams. Stock volume equal what? 5 milliliter. اوكي. انت محتاج مين؟ amount of solution. Amount of what? Of solution. Amount of solution equal what? Yes. Desired dose equal what? 500. Stock strength 250 times what? 5 milliliter. Two times 5 equal what? The amount of solution is equal what? 10. Okay. What are the name of the illness causing bacteria that are commonly found in food? What are the name of the illness causing bacteria that are commonly found in the food? Yes, some of the illness causing bacteria that are commonly found in food are Campylobacter, E. coli اللي هي Escherichia coli, Salmonella and Listeria. All of these, this is the illness causing by bacteria that are commonly found in the food. The next question is, why is it dangerous to wash raw poultry? Why? Washing raw poultry spreads the bacteria, around what? Around the kitchen. Okay. Raw and undercooked poultry can be dangerous. Small amount of bacteria can make people very sick. Cooking to safe temperature normally kills dangerous bacteria. Avoid تجنب washing raw chicken, as this will what? Your answer is spread the bacteria around the kitchen. Wash and sanitize anything that raw poultry has touched. Clear? Why is dangerous to wash raw poultry? Washing raw poultry spread the bacteria around the kitchen. I told you raw and undercooked poultry can be dangerous. Small amount of bacteria can make people very sick. Cooking to safe temperature normally they kill dangerous bacteria. Avoid washing raw kitchen, as this will spread the bacteria around the kitchen. Wash and sanitize anything that raw poultry has touched. What condition do bacteria needs in order to grow? ايه هي الحالات ان البكتيريا محتاجاها عشان تنمو؟ محتاجة time، محتاجة worms اللي الدفء، foods الطعام، water المية. Bacteria grow by multiplying and they can do this very quickly. They need certain conditions to grow. These conditions are times. Bacteria double every 15 minutes. This means that within 6 hours, one bacterium can multiply to over 16 million. Worms. Bacteria needs worms to multiply. The ideal temperature is 37 degrees Celsius. They can multiply in temperature between 5 degrees Celsius and 60 degrees Celsius. Food. Just like people, bacteria needs nutrients to grow, like meats, like seafood, cooked rice, cooked pasta, milk, cheese, and eggs are all food that provides very good growing condition for bacteria. Need water. Bacteria needs moisture to grow. What conditions? Time, worms, food, and water. What is cross-contamination? Contamination is when food becomes dangerous. Why? Because it contains harmful or what? Or unwanted substance, like what? Like bacteria. Okay. cross contamination is how bacteria can spread in food. Okay, cross contamination is how bacteria can spread in food. بتحدث ازاي when bacteria from another object or piece of food come into contact with clean food. This happens when raw food touches cooked food. Cross-contamination can result in food poisoning. Okay? What is cross-contamination? Cross-contamination is how bacteria can spread in food. First, salad can contaminate the other ingredient in the salad through which types of cross-contamination? This is food to food. Okay, this is when contaminated foods comes into contact with clean food, raw or an undercooked or unclean food can contain large amount of bacteria which can spread to other food that come in contact with it. This can happen if you let raw food touch clean food, or the liquid from raw food drips onto the other food either in the fridge, chopping thoroughly, or while preparing food. Your answer is which type of cross-contamination, which is food to food. What is the difference between cleaning and sanitizing? Okay, what is the difference between cleaning and sanitizing? Cleaning is the process of removing. Cleaning is the process of عبارة عن عملية is the process of removing dirt. Removing dirt. And sanitizing is the process. Sanitizing is the process killing what? Bacteria. Killing what? Killing bacteria. Cleaning is the process of removing dirt. Sanitizing is the process of killing germs or disinfecting. Okay? Cleaning while preparing food so bacteria don't have a chance to grow. ما فيش عندها فرصة ان هي تنمو. By special attention to equipment that may touch both raw food and the mouth. Sanitize cutting boards and equipment after they have been in contact with raw meat or seafood. Don't forget to clean and dry the cleaning equipment as bacteria grow fast in slightly wet places. Okay. Which temperature should food be cooked to in order to kill bacteria and make it safe to eat? Proper cooking can kill almost all dangerous bacteria. Cooking food to excellent 70 degrees Celsius can ensure it is safe to eat, as temperature of 70 degrees Celsius can kill large groups of bacteria within 30 seconds. تمام. How can you check food is properly cooked if you don't have a thermometer? Sometimes a thermometer will not be available. مش thermometer ممكن ما يكونش متاح. There are other ways to check the food is properly cooked. This include cook meat and poultry until the joints are clear and the inside is not pink. Cook eggs and seafood until piping hot the whole way through. Boil liquid-based food like soup and stews. Allow them to remain boiling for at least 1 minute. The criteria for this question identify the importance of proper hygiene practice when handling and storing food and preparing meals. How can you keep food at safe temperature? Cool and store all leftover food quickly. Slice large pieces of meat into smaller pieces and place food in a clean or cool container. leftover food should not be stored in the fridge for more than what 3 days and shouldn't be reheated more than once. This is because ودي بسبب ايه؟ food enter the danger zone ان الطعام بيدخل منطقة الخطر once it reheated and bacteria can grow quickly وبالتالي البكتيريا هتنمو بشكل سريع. Though frozen food in the fridge cool hot food until the steam no longer rises from it. You shouldn't leave hot food to cool for more than what 2 hours. Okay, this is how can you keep food at safe temperature. What is the name of severe allergic reaction? This is anaphylaxis. Anaphylaxis, which is a severe allergic reaction to certain foods, and it can lead to what? It can lead to death. How is anaphylaxis treated? Anaphylaxis treated. Anaphylaxis is a severe allergic reaction to certain food, and it can lead to death. The sufferer should be treated with an injection of adrenaline that comes in the forms of an auto injector, and an ambulance should be called immediately. Okay. And finally, we have how serious is a food intolerance compared to food allergies. A food intolerance often affects only the digestive system and cause less serious symptoms. Food allergy and food intolerance. Food allergy, it usually comes on suddenly, but food intolerance, it usually comes on gradually. Food allergy, small amount of food can trigger a reaction. A reaction may only happen when a lot of the food is eaten. Food allergy, a reaction happens every time the food is eaten. Food intolerance, a reaction may only happen if the food is eaten often. Food allergy, it can be life-threatening. Food intolerance, it is not life-threatening. Okay. وبكده نكون انتهينا من سرد هيكل امتحان مادة العلوم الصحية للصف الثاني عشر المتقدم. أشكركم على حسن استماعكم، وأتمنى أن أكون عند حسن ظنكم، وشكرا والسلام عليكم ورحمة الله وبركاته.